Hey guys, we're going to jump on here real quick and share a case study with you, but a little bit of a twist for a case study. So just got done with patients today, had an eval that was, how old was she? She's probably like 65, 70, coming in with a complaint of several months of groin pain, low back pain, some weird tingling in her thoracic spine, and some intermittent shooting pain down her legs. So, sounds pretty interesting, right? So, I want to give you a heads up here. This is going to turn into a rant because of what this patient has had to go through. But it's going to be a rant with purpose. So, instead of just going off, I want to teach you something about this patient and what I did. And I'm not going to go deep into the treatment. I'm going to go into patient education and dealing with a patient who, in my opinion, has been getting screwed. And basically nothing that she has been experiencing treatment-wise has been anywhere near where it should be. And I've had several people ask, you've talked about physical therapists. We know you are a physical therapist. Or actually, they say, well, you talk about physical therapists and tell us how terrible physical therapy is. Why don't you ever get in on chiropractors? So here we go. So one of the reasons I don't get in on chiropractors is I'm not a chiropractor. I don't believe in what chiropractors do, but I don't believe in what physical therapists do for the majority either. So I don't get in on chiropractors because that's not my profession. That's not my deal. But I do have and have had chiropractors that I have taught 180 to and go through the shift. And I hear the same stories from chiropractors that I hear from physical therapists. So here's my rant on chiropractor garbage and how I educated this patient about what's going on so I could give her the best treatment that she can possibly get, not only here, but how she can educate herself and have an understanding about what she's been doing, why it's total BS and why she's been wasting money, and what she needs to do to get out of that and actually get to where she wants to go. All right. So here we go with the case study with a little bit of a twist of a rant with purpose. Let me know if you like this. All right, so patient comes in and she's got all of her testing procedures that she got done from the chiropractor, and I can see what they are. I already know what they are without even looking at them. She puts them on the little table that she puts her phone and everything on. And I say, okay, so tell me what's going on. And she's like, well, how far do you want me to go back? So here is where I give people a little bit of leash and let them talk about what they want to talk about. But as soon as we start going back until they were 12 years old and fell off a horse, I reel them in and say, okay, let's get down to what we actually need to talk about. So she started off with, well, for years I've done this and I've had this problem. And then a year ago I had bilateral groin pain. That was an issue. And so I started seeking help for that. And then about 6 months ago, it turned into like tingling things that I was getting in my shoulder blades and my thoracic spine. And then it turned into low back pain. And now I feel like I'm starting to have leg symptoms. And so she's reporting all of these weird symptoms. And I just keep saying, okay. And so I finally cut her off and I said, okay, so what are these symptoms keeping you from doing? What can't you do that you want to do? She said, well, I'm pretty active, but I have to admit that I'm also really sedentary because my hobby is quilting and knitting, which is mostly sedentary. And she really doesn't want to increase her activity level, but she's tired of just having pain. Okay. So I said, okay, so do you have deficits in strength? Does it feel like you're weak when you're walking up and down stairs, getting out of chairs? Do you feel like you're losing your balance? And that's when she said, yeah, I feel like I'm getting weaker. My legs are getting weaker when I do go for a walk or when I do have to go up and down the stairs. I feel like that's becoming more of a problem. I said, okay, so is today a typical day? So remember, the most frequent questions that I want to know is there a mechanism to what's going on? Or was there a mechanism? What have they done for it? What do they want to be able to do that they can't do? Is today a pretty typical day as far as their symptoms are going? That's about all I want to know. I don't want to know, is the pain burning, numb, tingling, sharp, dull, whatever, blah, blah, blah. All I want to know is what happened? What have you been doing for it? How's that been working? And is today typical? Am I seeing you at a normal level? So get her up out of the chair, and before she gets out of the chair, she said, well, I have my chiropractor reports of all my scans. And I said, I don't need to see that. She said, okay, do you want to know what they told me? I said, nope, we'll talk about that in a little bit, but I don't want to know what they told you. And so she took off her shoes. I could see that she had orthotics. And she pointed out, she said, well, it's weird to walk with my shoes off because I have these inserts. And so I took the inserts out of her shoes, different kind of insert that I hadn't seen, different logo. And what do you know? It's from the chiropractor that she went to see that ran all the bogus tests. So I said, did you get these from the chiropractor? Oh yeah, she gave those to me. And I said, well, why? And she said, well, when she did my scans, she said that I was really crooked. And that if I stand on these, then that will give me a lift and give me more support. So then I'm not so crooked and my shoulder isn't lower on one side than the other side. And I said, okay, well, we're going to get rid of these. So I put the orthotics on the table and I said, okay, go ahead and walk. And so she walks away and she comes back and she said once again something about the shoulder. And I said, well, it's because of your scoliosis. And she said, what? And I said, you didn't know that? I mean, she has a baggy shirt on and she has obvious scoliosis. Her pelvis is crooked, tilted, her spine, scoliosis, shoulder down because of scoliosis. I mean, everything is textbook scoliosis. And she said, what? I have scoliosis? And I said, wait a second. You went to a chiropractor that did all of these scans and hooked you up to all of these machines and made you inserts because your feet are this and that. And she didn't even tell you that you have scoliosis? And she goes, no. Is it that obvious? And I said, yeah, I think most non-medically trained people could look at you and tell you you have scoliosis. And she's like, okay. And I said, so forget about the scoliosis. Forget that I told you that. And I run her through the screen. So toe touch, obvious scoliosis. Squats down and is completely shifted. And I said, does that feel like a normal squat? Or does that feel like you're stiff? Or does that feel like you're leaning one way? She goes, no, that feels pretty typical. And I said, okay. Have her do single leg squats. She's all over the yard. Can't stand on one foot by itself. I said, okay. So did upper body, cervical spine. That was pretty good. Put her on the table, start testing tough stuff, and she's failing all quads, all hams, all glutes, all hip rotators, dorsiflexors, plantar flexors. So she's failing everything. I'm going through and treating things, and she's like, oh, wow, what happened? So remember, before I tell patients what we are doing with neuromuscular facilitation tests, how I'm refacilitating the inhibited muscles, before I explain that to them, I test and treat and retest at least 4 or 5 muscles so they can feel the immediate difference between inhibition and facilitation. So explained to her after I did a couple things, this is what is happening. This is why, and she was telling me about, well, my chiropractor hooked me up on the machine, and the machine told her that this hip was higher than the other hip. And I said, she needed a machine to do that? And she said, yeah, that's what she needed. And I said, okay, so how did she treat you? Like, what was the treatment after she found out that you had all these problems? What was the treatment? And she said, oh, well, she would, test my strength, like have me put my feet in her hands. And then if I pushed lighter on one than the other, then she would have me do an exercise. And I said, how's that going? And she said, well, I don't think it's working very well because I keep going back and it's kind of the same thing. And I said, it's not working at all. And she said, oh, okay. And she said, well, she said I might need to get more scans. And I said, well, when you get more scans, that means your chiropractor gets paid more to tell you more stories about things that you don't have wrong with you. And she said, what? So here we go on Rant with a Purpose. So this lady's been getting screwed over by this chiropractor for about a year, doing all this bogus bullshit. If you can't look at somebody, if you're a chiropractor and you can't look at somebody with a baggy shirt on and tell that they have scoliosis and watch them move and tell that they are dysfunctional all over the place, but yet you have time to hook them up to machines to charge them for charts and screens and printouts of bullshit, and then charge them for your custom-made orthotics, you are a scammer. So I don't have any problem telling this patient that she's getting scanned. And as I'm talking to her, I'm getting pissed because of what this chiropractor did to her. So I said, you don't need to have any more scans. You don't need to be hooked up to a machine. I've already figured out what your problem is, and I've already fixed half of the problem so far. I'm going to fix the other half in the next 10 minutes. And she said, oh, and I said, so you know how these things are stronger after I get done treating them? She said, yeah, it's kind of crazy that you're able to do that. I said, well, I'm going to do that throughout your whole body here. We're going to get you back up and see how you move. And then I'm going to give you things to do at home to help you keep things plugged in. That is going to solve your problem. Going to see this lady who has been scamming you and ripping you off is exactly what I said. Scamming you and ripping you off to have more tests, to have her do more garbage is not going to fix your problem. And I could see her kind of like sink into reality. And she was like, yeah, I've been wondering about that. It is your job as a medical professional, when you find out that somebody is getting scammed, it is your job to tell them to stop wasting their time and money with people that are doing nothing but screwing them over for money. So please, even if you don't think you can help them, at least tell them, hey, this is not a good idea. This makes no sense. You've figured it out. She already figured out that it made no sense. She already figured out she wasn't getting better. She already figured out that the tests really weren't doing nothing. And when I told her that she had scoliosis, she actually said, you know what? I went to a doctor for a physical years ago, and they said that I had scoliosis. And that's the only person that's ever pointed that out to me. And I said, well, here's what you need to understand about your scoliosis. I'm not going to fix your scoliosis. It's going to be the same when I get done treating you today, and it's going to be the same for the rest of your life. That's not your problem. Your scoliosis has been there since you got done with puberty, most likely, okay? That's not the problem. The problem is you're trying to dance around symptoms and change the way you're moving, even though the way you're moving is the way you are supposed to move. So just because you have scoliosis and you're crooked and you're shifted and you do this and you do that doesn't mean that's wrong. I'm not going to change that unless it changes by itself after I correct these inhibitions that we were talking about. If that changes the way you move, then we're going to change the way you move. But I am not going to reverse your scoliosis. And if anybody ever tells you that scoliosis is your problem and they're going to fix that, get out of that office as fast as you can. All right. So got her off the table, had her walk. She said, wow, I feel totally different. I don't understand. I don't know how to explain it, but I feel totally different. I said, okay, well, you're walking different, so that's good. I said, go ahead and squat down. She squatted down, ass to grass, no shift. And other than the scoliosis, was a beautiful squat. And she said, I said, how's that? She goes, well, now I know what you were talking about before when you said that I moved out of the position. I feel like I stay all the way down, like I'm staying straight, like I have equal weight on my feet. And I said, that's exactly what I'm looking for, and that's exactly what's happening. So that's perfect. Had her do 5 single leg squats on one foot, 5 single leg squats on the other foot. She didn't lose her balance once. Okay? So these are the things that I pointed out to her. I said, this is what's important. You are moving completely differently than you were moving when you came in. So now it's our goal to keep you moving this way and work on strength and endurance so that you continue to move this way, because when you move this way, you're not going to have pain. And all those weird things that you were having going on could have been suggestion from the chiropractor who is scamming you. Yes, I did say that. And they could be because mechanically you're so dysfunctional that you're compensating all over the place. And once you stop compensating and move the way your body was made to move, that problem might go away. That's what we're going to have to see. So there's my patient education to a patient. Do I have any problem outing some chiropractor, physical therapist, massage therapist, acupuncture, whatever, healing toucher, whatever bullshit is out there? Do I have any problem calling them out? No. That's my job, to do what is best for my patient. I cannot do what is best for my patient and say, okay, here's all the stuff that I did. If you want to keep on seeing your chiropractor, that's up to you. That's bullshit. because I know as soon as she goes back to the chiropractor, they're going to fill her head with more garbage that's going to send her backwards, and likelihood of them undoing everything that it took me to do in the last half hour in 5 minutes with their machine and vibration shit and whatever they're doing is highly likely. Okay? So as a medical professional, as a student who is going to be a medical professional, when you see people getting scammed, it is your job to get them away from those people. Then it's your job to figure out how to fix their problems. And if you don't know how to do that, and you're watching my videos trying to figure out how you're going to do that, here's the easiest way to figure it out. Learn 180. Join the shift, spend the next 4 months working with me and our community, and you will be able to help people do things that they never thought they would do, and things that you probably thought they never would do because you didn't learn how to do that in school. Which dovetails right into our webinar that's this Sunday. Make sure, if you like what I just said and you want more information and more breakdown on how we do this, I'm going to do an hour-long webinar where I take a patient, sciatica, low back pain patient, walk you through the whole 180 system from functional screen to treatment to patient education to exercise to refunctional screen, so you understand exactly what happened here. And I'm going to tell you along the way, each step, how you did not learn that in school. And you're going to figure out how many things you didn't learn in school, how many lies you were told in continuing ed classes, how terrible your mentor was, because I'm going to expose all of that too. And you're going to learn in an hour what you didn't learn in 3 years of grad school. So if you have questions for me about this video, DM me, shoot questions down below. I would rather you post the questions down below so that we can open up the conversation to the rest of this community. But make sure for sure that you are here, or you get your ticket, which I'm going to put down below in the comment. Get your ticket for the webinar this Sunday, and I will teach you more in 1 hour than you learned in 3 years of school. See ya.